proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, reduce the reduction of acids by locking the enzyme in the walls of the stomach, thus reduce acids. Acids is necessary for the formation of most ulcers in the esophagus, stomach, and duodenum, and the reduction of acids with PPIs prevents ulcers and allows any ulcers that exist in the esophagus, stomach, and duodenum to heal. The currently available PPIs include omeprazole, lansoprazole, pantoprazole, rabeprazole, esomeprazole, dexlansoprazole. PPIs are very similar in actions, and there is no evidence that one is more effective than another. They differ in how they are broken down by the liver and their drug interactions. The effects of some PPIs may last longer, therefore they may be taken less frequently. The most common side effects of PPIs are headaches, diarrhea, constipation, abdominal pain, flatulence, fever, vomiting, nausea, thirst. PPIs may increase the risk of Clostridium difficile infections of the colon. High doses and long-term use, 1 year or longer, may increase the risk of osteoporosis-related fractures of hip, wrist, or spine. Prolonged use PPIs also reduce absorption of vitamin B12. Long-term use of PPIs has also been associated with low levels of magnesium, hypomagnesemia. Analysis of patients taking PPIs for long periods of time show an increased risk of heart attacks. Therefore, it is important to use the lowest doses and shortest durations of treatment necessary for the condition being treated. PPIs interact with few drugs. 1. The absorption into the bodies of some drugs is affected by the presence of acids in the stomach, and because PPIs reduce acids in the stomach, they may affect the absorption of these drugs. Specifically, PPIs reduce the absorption and concentration in the blood of ketoconazole and increase the absorption and concentrations of digoxins. This may lead to reduced effectiveness of ketoconazole and an increase in digoxin toxicity. 2. PPIs can reduce the breakdown of some drugs by the liver, at least should increase in their concentrations in the blood or measures is more likely than the other PPIs to reduce the risk down of blood by the liver. For example, a measures may increase the concentration in the blood of diazepam, warfarin, and phentoids. 3. A measures reduce the effects of lapidaries by blocking the conversions of lapidaries to its active form. This combination should be avoided. Nevertheless, PPIs generally are well tolerated. Fortunately, the overall risk of long-term PPI use still seems to be relatively small. Risk and follow the directions on the OTC fast labels when considering the use of OTC PPIs. Talk to your healthcare professionals about any concerns you may have about using PPIs. Thank you very much